Good afternoon, friends. I'm Dr. Virendra Kumar. I'm a cardiologist based at Bhagalpur. Today, we are going to discuss on this live Facebook session about the emerging trend of the cardiac diseases, specifically heart attack in young population, which is a very emerging topic. Recently, we have lost so many important and famous lives, and the topic is very hot and debatable, and we need to discuss these things. Why the Indian population, young population of India, is getting more and more heart attacks, and we hear so many celebrities had undergone the deadly myocardial infarction. Many lost their life, and recently we heard about the Susmita Sen, the singer KK lost life a few months back, and recently we had heard about even the sports person like Saurabh Ganguly. 1 year back, he had an heart attack while he was gymming, and what I think and what everybody feels like that this is a topic we must discuss, and uh, that's why I chosen to go live with this topic, and so that we can have some fruitful and knowledge in back of mind for a general public, and even for the healthcare worker and doctors must have in their mind that this disease has had more and more young population are getting affected by this disease, and we must discuss this broadly and extensively so that we can have insight into the disease, why this trend of young patient getting myocardial infarction in our society. As we know that the grossly these lifestyle diseases, those diseases which are due to our change in the lifestyle, change in the food habit and the living standard and the way we are living. So the trend is such that this disease is becoming more a disease of young population. You can say that the incidence, the number of cases of this deadly myocardial infarction is increasing in our young population. So we definitely need to discuss these things, at least this, why we are getting more and more cardiac patient in young population. So coming to the discussion, we will have uh, the background issue, because we know that this myocardial infarction, that is in the layman's tongue, the heart attack, is a disease where blood flow to the heart and myocardial tissue becomes low or is cut off. Once the blood flow to the heart goes off, the oxygen supply to the heart muscle is cut down and the heart muscle starts dying. Once this heart muscle starts dying, we perceive it as a chest pain, severe diaphoresis, the sweating, excessive chest pain, shortness of breath, breathing difficulty, and many times dizziness or even loss of consciousness are reported in those cases where there is sudden chest pain and severe chest pain and diaphoresis. There people even faints and falls on the ground. They had severe pain like anything. So these are the symptoms usually people have. So why this disease is becoming very common in young? So we have to find those causes which are actually causing premature blockage of the artery, whether these blockages are hard or soft, why this blockage occurs, what from the pathophysiology, the disease, you can say the medical point of view, we know that the once we age, with the aging, everything becomes a bit older, and so is the case with the coronary artery, the arteries of the heart. Once these artery age, their wall, internal side of the wall of the arteries, the blood vessels becomes stiff. There is fat deposition, and there are so many other things deposits into that, which is named as plaque. Once this plaque progresses, it gradually decreases the lumen of the heart vessels. The blood vessels lumen inside, that is the tube which supplies the blood to the heart, gets narrowed, and the blood supply to the heart becomes less and less. Once this blockage progresses with the age, we, as a patient or anyone who has those blockers, that he perceives the pain on exertion when he does something extreme, strenuous or exertional work he does. He feels chest pain. Once he stops doing that work, pain relieves. That is called angina. When the blockage progresses more, and it reaches to a point where blood flow to the myocardium, the muscle of the heart, is almost finished. That is almost 1-2% or 3% or almost cut off. The heart muscle does not get any oxygenated blood and it start dying. That is the situation which is called heart attack. So angina, heart pain is on exertion is angina. Any chest pain which occurs while we walk or do work is called angina. But when it occurs at rest without any provocation, then you call it a heart attack. For a general person, any pain, any chest pain which occurs without provocation or exertion, or with minimal exertion or provocation, is likely to be a heart attack. So coming to the basic topic, why this heart attack is becoming common in young population, which was supposed to be a disease of the elderly, of the aging population. So something happened to our artery. Either our arteries, that is blood vessel of the heart, is becoming prematurely, aging is going there or taking place there. In another word, you can say that we are aging at fast. Our blood vessels are aging at faster rate, and even if our biological age is 30 or 40, our blood vessels are of 60, 70 years old. One thing is that. Another thing is that our blood flow to through the artery is not that, you can say, the seamless flow of the blood is not there. Blood is are becoming more thicker. In technical word, you can say our internal environment of the body is such that even the external environment in which we are living is such that it is promoting more of the clotting of the blood inside the artery. In simple word, you can say that the normally we our blood flow is supposed to be such that it remains in a fluid state with a good flow without any turbulence in the blood vessels. If any of the factor which causes the blood to flow to be slowed down, or blood becomes more thicker, more adhesive, more, it's less like water, more like a curd or milk, then the hampered blood flow or slowed blood flow decreases the oxygen delivery to the myocardium, and patient starts feeling chest pain. When blood becomes very thick or becomes in the form of clot, then suddenly some blood vessels gets choked or by this clot, which normally forms on this plaque, that is inside the blood vessel, the fat deposition or cholesterol deposition, which in young population there is not significant blockage, but there is fat deposition in the blood vessel. Many a time this fat deposition or cholesterol deposition in our artery is such that it is a bit of inflamed, that is swollen, and the blood cells goes there, sticks to that, and becomes a sort of a small clot. That clot grows and it blocks the artery, and patient gets heart attack even at the age of you can say 20 or 25. In last 2 weeks, I have seen 3 patients in the age group of 35 to 40 who has suffered from a major heart attack, and they all underwent primary angioplasty. Luckily, all 3 patients survived. What I remember, there were 4 or 5 patients in last week, but all 3 of them was younger. One was 26-year-old, and 3 were two were between 35 to 40 years age. So what is more important to understand this, there's a new angle of the major heart attack, you can say myocardial infarction or heart attack, why it's occurring in young population. One is that we have started aging very fast. Our blood vessels are aging very fast due to the environmental factor or internal factor. What are those environmental factor which are playing, we'll discuss, and what are the internal factors we will discuss, and we will try to have an idea how can we modify these internal and external factor to modify the disease course and prevent the young population of the country from getting heart attack. So second was the our internal milieu and external milieu, external environment is such that we are more thrombogenic, that is clot forming tendency of our blood is becoming more. Our internal environment is not very in sync with the system. Rather, our internal environment is basically have some inflammatory component. Like you can understand very well that if something if your body is in good health, you feel at ease, there is no inflammation, there is no sign of inflammation. What are the signs of inflammation? That is the redness, pain, swelling. These are not there. Similarly, inside the body, if the internal environment of the body is inflamed, not at the proper stage of the hemostasis, then internal environment is inflammatory. Environment will produce more and more of the inflammatory mediators. What are those inflammatory mediators? These inflammatory mediators are those which causes pain, which causes raise in temperature, fever, and other things.